Good morning, beautiful doctor.
Good morning. Good morning.
Welcome to the Morning Show. Thank you for your time.
Yes, so I'm so excited actually to learn and learn and see at the same time to do the CPR itself. And because as we mentioned, heart is very important, parts of our body, right? So it is the main core aside of our neural itself. So doctors, we're going to dive more into this CPR. Now first, let's start with the first aid for a cardiac arrest, or CPR for the cardiac arrest, now, which might occur due to age or over exerting in sports itself. So can we tell if we are anyone else is about to suffer this kind of heart attack, and what are the symptoms that we should acknowledge or we should know about that?
First of all, we have to differentiate between a heart attack and cardiac arrest.
Right.
While cardiac arrest is the completely stopping of the heart, so it stops pumping.
Okay.
While in heart attack, the heart doesn't have enough blood flowing into the heart.
Right.
So there is lack of oxygen flowing into it. If the heart attack is not treated, it can lead to cardiac arrest.
Right.
Then we're gonna do the CPR in the cardiac arrest. But for heart attack, the symptoms include very chest pain, very painful chest pain that can radiate. It can radiate to the neck or to the back or to the arms.
Is it like a burning sensation?
It's kind of different because in heart attack, you feel like there's an elephant sitting on you.
Right.
Yeah, so it's very heavy.
Okay.
It feels very heavy, and you have difficulty in breathing.
Right.
Yeah, sometimes you also feel nauseous. You can vomit and very severe sweating.
Right.
Yeah.
And also we have to know the difference between GERD itself.
Yep.
Because if you are feeling GERD and you don't know exactly what it is, most of people consider it as a heart attack or something like that, but it's also GERD, so we have to know exactly the difference.
Of course.
So doctor, the next question is, we will discover first aid in a heart attack. And what is the difference between handling the person when the person is conscious and unconscious?
Well, again, back to what Valencia has already said, when a person is in a heart attack condition, they're still conscious. But when they're unconscious, it means they already experienced cardiac arrest.
Right.
So the heart is stopping. So when they're still conscious, it's still on a heart attack.
Okay.
So the first aid is actually we cannot do nothing. So what they're supposed to do is just go directly to the hospital, to the emergency room in the hospital, because time is everything when you experience heart attack. And foremost is for the families not to be
Don't panic.
Yeah,
Don't panic.
just to be calm.
Well, even though it's a bit hard,
It's a serious condition, but it's very important for the person and the patient to keep calm and then bring them to the hospital directly, because when in a heart attack, they need more proper treatment from the hospital instead of what we can give.
Okay, so the first thing first, that maybe beside a heart attack, what we can do for the passenger or for the people?
All right.
The treatment.
Maybe for the CPR is only for cardiac arrest.
Okay.
So yeah, we have to differentiate it. The heart attack is when there is not enough blood pumping.
Yes.
So you have to release what is it that caused the blood that cannot flow inside.
and do a certain pressure to the chest itself, so in order to actually stimulate the blood itself, circulation, right?
Yeah.
Now, in order to do that, that's why we have you doctors
Yep,
here,
sure.
because we want to learn more about that. So, what is the simplest way, or the first step that we need to do if we caught somebody with a heart attack? So what do we need to do with that person first?
So if it's a heart attack, then you bring the person to the hospital immediately.
Okay.
If it's a cardiac arrest, then the person usually just suddenly fall, and they stop breathing.
Right.
Then we have to recognize that that person is unconscious and has stopped breathing.
Right.
Then first, if we know how to do CPR, then we'll have to introduce ourselves first,
Right.
and also check for the consciousness of the patient. It's called AVPU, alert, voice, painful, and unresponsiveness. And you do it all together just by calling the patient, like you call him, like give a firm tap, like call sir, are you awake? Are you okay? If he doesn't respond, give some pain stimuli. Painful stimuli can be given from the chest in the middle of your sternum here. Just use your fist like this and rub it. It's very painful. So if he's unconscious, he will not respond at all.
Okay, can we do this?
Yeah, sure.
Do the demo.
You can do it
demo right away?
Yes.
Yeah, sure.
Sure, go
So
ahead.
you are going to show us how to do so. Right, okay.
Dr. Fale.
All right. Okay.
So we have to take a look. So, Mama.
Yes.
Okay, we have the mannequin here. Okay, so if somebody, let's say this person was just running, jogging like in the park, and he suddenly fell unconscious, and he stopped breathing. So we want to help. So we'll have to call him, sir. Then nothing, right? No response. Then we use this. You use the knuckle and do some painful stimuli. Oh, nothing happens.
Oh, okay.
Then we know that he's unconscious. Tell somebody to call the ambulance, 119. You have to call because...
so the number is 119.
Yeah, 119 because we're going to need help afterwards.
Transporting
after the CPR.
the
Yeah, that's
person,
true.
right?
Yeah.
Right.
Okay, and then we know that this person is unconscious and needs help. So we need to check the environment. Is it safe? Is it safe here? Are there like passing vehicles that can be dangerous for us and for the victim? Then we have to transport the patient to a safe area then.
Of course, yes.
Yep. After that, then we can start the CPR.
Right.
Okay. So there are some principles while doing the CPR. First, your dominant hand should be on top of your non-dominant hand.
So you should...
And then you place the heels of your palms on the middle of the chest.
Right.
Just on the heart area in between the chest.
Right.
And you do a compression that is about 5 centimeters in depth.
Right.
So make sure it reaches the heart.
Right.
Yep. And the rate is quite fast. It is about 100 to 120 beats a minute.
Right.
Yeah, so just like how the normal heartbeat
goes,
beats.
right.
Yep, that's true. And make sure that you have the recoil. So what it means that when you push down, make sure it goes back.
Right.
So you don't only push and push and push, but you let it release.
You have to wait,
Yeah, you have to let it release. And make sure when you're doing it, there's no interruption.
Okay.
So you concentrate on it.
Of course.
All right. Okay, I'm gonna demonstrate. So like this,
Right.
and put it like this.
You do it like this, like what Dr. Valencia does.
Right.
Yeah, we can see the arm should be straight, so it's like 90 degrees with the surface of the chest.
Right.
And then you do the movement from the body.
Right.
Yeah, so you don't do it using the arms, but you move it from the body because
So
when you're using
the whole body
whole
is
body.
actually putting pressure.
yeah, so you like drop your body into the
Yes.
chest because if you do it only from the arms, it will get tired.
Right.
Oh, that's the technique.
Yes.
The main technique from
And
your
this is
body.
very tiring. Doing this is very tiring.
Of course, of
Yeah.
course. Now, when we perform this CPR, CPR, sorry. That's PCR, is another one.
We usually do PCR.
As we are performing this CPR, doctors, so we are, determined to do so in the range of how many minutes?
Yeah. So when to stop? It's like when to stop to do the CPR. Yeah. So the first thing is when the paramedic comes with the ambulance, so we have to stop. And the second one, there is no standardized when to stop. So it's just when you're feeling tired, when you
So you
cannot
switch.
continue
Yeah, you
enough.
switch immediately.
If there's other person,
Right.
you can switch immediately. But if there's no other person, it's okay for you to stop because you should not put yourself in danger too.
Oh, okay.
Got it, because we know that
Because
in
it's very
Jakarta or maybe in some place that it is accidents and ER room is so far because the time is so much needed, right?
Yeah,
Okay.
true.
Now, doctors, just to give us more information, so for the patient itself, so we need to lie the patient on the ground without anything on their necks, right?
Yep, no support.
Yeah,
Just
can you
nothing at
elaborate
all.
with us more?
So it has to be on the hard surface like this. This is like a perfect condition for the patient to
Right.
lie down.
Yeah.
And we should not put anything on the
Neck area or
neck
the head
on the
area
head
itself.
Yep.
Okay. So the pressure only comes from the person who is actually giving the CPR itself, and then we need to press down in 5 centimeters depth.
Yes.
And also we need to press down, and the what do you call that? The pressure comes from our own body, not
Yep.
from our hands,
Yeah.
right?
The hands, but the whole
Right.
body.
From the whole body itself. Okay, so don't forget to call the ambulance. It's,
That's
Don't
true.
forget the number one rule. Don't forget
Ambulance
to call
first,
the
okay.
119.
119.
119.
Doctors, obviously, when we're doing this CPR actually to save someone's lives, it is very different when we are in a situation, Christy, when you go to the restaurants and then you see little kids choking and then their parents, they don't know what to do. And also maybe the waitress, they are not qualified as well to help the little kids. We need to know more about that, doctor. So what do we need to do?
Okay, so
We can sit
Maybe,
back.
we are going back to our place right now.
Okay.
Thank you, doctor.
So obviously, it's something, you know, we never thought about, you know, having our loved ones, you know, in a situation
Yes.
such as choking, right? But sometimes those kind of bad situation occurs in, you know, in times that we don't even understand
Expect.
when, right? Expect, that's right. So what is the first step that we need to do when we see, you know, grown up or a little child is actually suffering, choking?
okay, so what not to ask is, are you okay?
No, yeah.
Because it's because
Of course
sometimes
it's not okay, right?
yeah, because of course they're not okay, and sometimes it can mistaken when they say not okay. We not like directly know that they're choking or not, because
Right.
when you see people in difficulty in breathing, there might be another condition like asthma. So we should ask it directly, are you choking? And they can nod it or say yes.
Yes.
Yeah, so there's this one universal sign for choking actually, and you can identify it by it. So like when the person putting their hand on their neck,
Right.
like this. Yeah, sometimes we can assume, oh, okay, you're choking.
Right.
And then if they're still talking or nodding, it means that they still in better condition.
Yeah.
So we can ask them to cough, actually, hard cough, like coughing to remove the object first before we try to another maneuver, which is very painful for them. So we can ask them to cough first. Sometimes it can release the object,
Right.
so it's a better solution for it. But it's the same for children. Sometimes we can see the children has that not natural response, like cough. So we can monitor them first, whether the coughing is working, like whether they're crying out loud and trying to cough or not.
Right.
So when they're still able to do it and it can be removed by itself,
Right.
so it's fine.
Okay.
But if we see them started to stop crying and then they cannot talk, and then we have to help them to remove it. It's the same as as in an adult.
Of course.
So maybe I should explain for adult first.
Yes, of course.
So for adult, after they not able to cough and the object is still inside the breathing passage, can I do demonstration?
Yeah, we can do the demonstration. Back again to the. Okay.
You can
just
do
do
it
it
over
here.
here.
Live demo, we like this.
Yeah. So there are two maneuvers that we can do. The first one is called the back blow.
The back blow.
Yeah, the back blow. So we do it from the back.
Right.
Yeah. So we ask the victim of the choking to bend forward a little. Yeah, and then we do.
He or she will need to stand up, not to sit down.
Yeah, they
the
will need to
first
stand
thing
up.
first.
Yes.
Okay.
Okay. They bend over a little, and then we do the back blow with our heels of the hand, just like what we do when doing CPR, the heels of the hand. And then there's this shoulder blade, and we do it in the center of the shoulder blade.
Right.
So we do it in the direction of upward. So it's like upward thrust. So like this.
Okay.
This is like the very little power version of it, but in the real one you have to push it fast,
Right.
push it hard. I mean, push it hard, like do this. The
So
direction is
how many times
upward.
do we need to do that, doctor? Because in the CPR itself, it's like 120 times if we can do it like faster, right? But for choking,
Choking, we do it 5 times.
5 times.
1, 2,
So
5
1,
times intermittent.
3, 4,
5.
This is very important because the first thing first in Indonesia, especially when someone is choking or just keselak gitu ya,
Yes.
they just like this.
Yeah, they do it with no power, but actually you have to do it with the power. Yeah, okay, it doesn't help you.
Not helping.
Yeah,
Okay,
yeah.
there you go from the hard back.
Yeah, at the
with
back,
5
and then the
times.
direction should be upward, and use your power. It's okay.
Okay.
Just so
So if if,
do 5
doctor,
times.
that first technique doesn't succeed,
Yeah.
We go directly
There's
to
another
the second one.
Okay.
The second one called abdominal thrust. So it's the later one is from the back. This is we do it the thrust from the abdominal, so in the
Right.
front. But still we
here?
position ourselves behind the victim. And then we like make a fist with one of our hands and wrap our hands with another in our fist.
Right.
And then we encircle our fist into the victim's body.
Right.
And then we place the fist in this area. So
Okay.
it's like the upper abdominal, or we call it sometimes the
center,
epigastrium.
right? Yeah.
Yes.
The epigastrium
The
here. His
epigastrium
under
area.
grips.
So below the lower rib cage, but still in the abdominal area,
Right.
in line with the umbilicus.
Right.
Okay, so we encircle it, and we do it like the upward thrust too. So it's like we're trying to lift the patient or the victim. Like
So we need to put our foot
Yeah.
in the
of
middle.
course, yeah. And for the
okay.
support,
It's
it's
to
for
gain
the support.
support,
To gain
right.
support. So sometimes maybe if the victim is bigger than us, we need the support. So we put our dominant feet in between the feet of the victims.
Okay.
And then we do it like upward to like. So you
Upward still.
yeah, but push it and then do it upward, just like you try to lift the victim.
Oh, wow.
We do it 5 times too.
Okay.
times.
Yeah, so 5 times for the back blow, 5 times for the abdominal thrust. If it still fails, do it 1 more time while calling ambulance.
Right. Okay. 119 still. Right. Now,
119.
doctors, how about in children?
Now,
How about in children? Now we have this.
that's why we have this. We bring this with us today. Yes. Yeah. So pretend that it is a child.
Yep.
So in a child, this is for example in an infant below 12 months old. So you put them in your hands.
Yep.
The first, so after they are not able to cough, the first one is in a prone position.
Right.
Oh,
Turn
yeah, make
them
it back.
Yeah, this is, we give them the back blow too,
Right.
but we put them in our hand like this.
Right.
And then you put your thumb in their jaw and the other hand and the other fingers in the other jaw. So help them to open the fingers.
Okay.
Yes, the mouth.
The
Sorry.
mouth.
Up. So they do it like this, and then do the back blow. Same.
Position is tilting down.
Yep.
Yeah. So the head should be below the body.
Right.
Yeah, in the position. So you do the back blow the same as the
5 times
adult.
still.
Yeah, 5 times still.
Right.
And then for the thrust, we call it the chest thrust. If in the chest thrust, they are in the supine position.
Right.
Still, we support their head with our hand, and then we do the chest thrust with 2 fingers
Right.
in the chest, like in the CPR, in the middle of
Right.
the nipples, like that.
Oh, there
Yeah.
you go.
Still in the upward position. So we should always do it in upward thrust.
Upward thrust.
There you go. Thank you so much, doctor, for the very important
Yes.
things that we should do, because something happened in life and we are not ready for that, especially for the talking time. We have to know it.
happens, in a split of second.
Well noted.
Everything changes. So
That's true.
again, we gained knowledge this morning, doctors. Thank you so
We're
very
happy to be here.
for
We're
the
happy
info
to be
and also
here.
the demo that we earned this morning. And of course, we're wishing you to have a successful life, healthy life, and also for you and your team to always helping other people. Thank you so very
Thank you so
much,
much.
doctor.